Hello, Dr. Chetna here. I am Pediatric Surgeon at Sohana Hospital. Today we'll be discussing about a child who had respiratory distress at birth. The baby was intubated at birth. The respiratory distress was so much, and on X-ray it was identified that there is congenital diaphragmatic hernia, means the layer between the stomach and the intestinal contents and the lungs was missing. And all the intestinal contents, including all the small bowel and the large bowel, was inside the left side of chest. So that is why the baby was not able to breathe. So we had operated on this baby and we created that diaphragm. Now the baby is 1 year old, perfectly fine, no complaints, no respiratory distress, no frequent pneumonias. And if your baby has any problems related to pediatric surgery, please come to Sohana Hospital.
Hi, my name is Kuldeep. I live in Chandigarh. So during the birth of my second daughter, so I visited Sohana Hospital. So she has taken a birth here on 5th of October. So on the very first day of her birth, she was not feeling well in terms of breath. So she has been taken to NICU, and after 4 or 5 hours, doctor said it is gonna take more time. So it took approx 12-14 hours. She was not okay in terms of breathing. So doctor have identified like she had some issues in terms of her diaphragm. So they have checked it, and they have said it's a very severe condition because diaphragm had a very big hole in it, and all of the intestine was on the upper side, which have pressed the lungs of the baby. And it was really very difficult situation for us also to decide what to do at that moment. So doctor suggested to do a kind of operation on the very first day of the birth, and they have done it. I really thanks to Dr. Chetna who has done this operation very successfully, and definitely it took time to recover the baby again. It took approx 25 days to 1 month. She was in NICU only because there are lots of complications started because of the operation at the very first stage. Okay, so after 25 days or 27 days, she got discharged, and we have taken care of her for approx 3 months to 4 months. They have suggested like the lung is not been properly grown. But right now we are not facing any kind of issues regarding to her health. She is okay as a normal child says. I really again thanks Chetna ma'am to do a very, you can say, a successful operation, plus Dr. Nisha, who have taken care of her during the tenure she was there in hospital. Thank you so much.